Hi, I'm Garvin. This video is on diabetes. So what is diabetes? Diabetes is a long-term or chronic condition caused by too much glucose or sugar in the blood. It is also sometimes known as diabetes mellitus. In Ireland, it is estimated that there are 200,000 people with diabetes, with many unaware. Normally, the amount of sugar in the blood is controlled by a hormone called insulin, which is produced by the pancreas, which is a gland that is located behind the stomach. When food is digested and enters the bloodstream, insulin helps to move any glucose out of the blood and into the cells where it is broken down to produce energy. However, in diabetes, because there is either not enough insulin or because there is a poor response or resistance to insulin, the body is unable to fully use the glucose in the bloodstream. So diabetes type 1, formerly known as insulin-dependent diabetes, which usually occurs before the age of 35, a person with type 1 diabetes makes no insulin and therefore needs to inject insulin to regulate blood sugar levels and remain healthy. Type 2 diabetes, or non-insulin dependent diabetes, more commonly occurs in adults after the age of 40 and is extremely common in old age. In this case, the person with diabetes makes some insulin, but the body does not respond properly to it. Around 95% of all people with diabetes have type 2 diabetes. Before people develop type 2 diabetes, they almost always have pre-diabetes, blood sugar levels that are higher than normal, but not yet high enough to be diagnosed as diabetic. Gestational diabetes, or diabetes in pregnancy. During pregnancy, some women have such high levels of glucose in their blood that their body cannot produce enough insulin to absorb it all. This is known as gestational diabetes and affects approximately 2 to 7% of pregnant women. In most cases, gestational diabetes disappears after the baby is born. However, women with the condition have an estimated 30% risk of developing type 2 diabetes later on in life. So signs and symptoms. Most of the symptoms of diabetes are the same for type 1 and type 2 diabetes. However, there are differences in the way the symptoms develop. The main symptoms of diabetes are feeling very thirsty, producing excessive amounts of urine, i.e. going to the toilet a lot, extreme tiredness or fatigue, and weight loss and muscle wasting, so loss of muscle bulk. Other symptoms of diabetes can include itchiness around the vagina or penis, recurring thrush as the result of excess glucose in your urine, and blurred vision caused by the lenses of your eyes becoming very dry. However, not everyone will experience these other symptoms, and they are not usually severe in those who do get them. If you have type 2 diabetes, the symptoms will usually develop over weeks or months. Your symptoms may develop so slowly that you do not realize that you are unwell for some time. Type 2 diabetes may also cause additional symptoms. For example, if you have cuts and sores, they may take longer to heal. It is sometimes possible to develop type 2 diabetes without having any symptoms at all, or only have a few symptoms. However, you will still require treatment to prevent other health problems such as kidney disease from developing later on. So diagnose diabetes. Diabetes is diagnosed by a simple blood test that detects how much glucose is in the blood. So the causes, type 1. In type 1 diabetes, your immune system, which normally fights harmful bacteria or viruses, attacks and destroys the insulin-producing cells in the pancreas. This leaves you with little or no insulin. Instead of being transported into your cells, sugar builds up in your bloodstream. So type 2 in pre-diabetes, which can lead to type 2 diabetes, and into type 2 diabetes, your cells become resistant to the action of insulin, and your pancreas is unable to make enough insulin to overcome this resistance. The risk factors for type 1 diabetes. Although the exact cause of type 1 diabetes is unknown, family history may play a role. Your risk of developing type 1 diabetes increases if you have a parent or sibling who has type 1 diabetes. Other factors have been proposed. used as well, such as exposure to a viral illness. Risk factors for prediabetes and type 2 diabetes. Researchers don't fully understand why some people develop prediabetes and type 2 diabetes and others don't. It's clear that certain factors increase the risk. However, including weight. The more fatty tissue you have, especially around your belly, the more resistant your cells become to insulin. And inactivity, the less active you are, the greater your risk. Physical activity helps you control your weight, uses up glucose as energy, and makes your cells more sensitive to insulin. So family history, your risk increases if a parent or sibling has type 2 diabetes. And for age, your risk increases as you get older, especially after the age of 45. Often that's because you tend to exercise less, lose muscle mass, and gain weight as you age. For gestational diabetes, if you develop gestational diabetes when you were pregnant, your risk of developing prediabetes and type 2 diabetes later increases. If you gave birth to a baby weighing more than 9 pounds, you're also at risk of type 2 diabetes. And polycystic ovary syndrome. For women having polycystic ovary syndrome, a common condition characterized by irregular menstrual periods, excess hair growth and obesity, increases the risk of diabetes. Other conditions associated with diabetes include high blood pressure, high levels of low density lipoprotein or bad cholesterol, low levels of high density lipoprotein or good cholesterol, and high levels of triglycerides. Another fat in the blood complicates short-term complications of type 1 and type 2 diabetes, require immediate care. Left untreated, these conditions can cause seizures and a state of unconsciousness. High blood sugar, hypoglycemia. Your blood sugar level can rise for many reasons, including eating too much, being sick, or not taking enough glucose-lowering medicine. Increased ketones in your urine with diabetic ketoacidosis. If your cells are starved for energy, your body may break down fat. This produces potentially toxic acids known as ketones. So low blood sugar or hypoglycemia. If your blood sugar levels drop below your target range, it's known as low blood sugar. Your blood sugar level can drop for many reasons, including skipping a meal and getting more physical activity than normal. However, low blood sugar is most likely if you take glucose-lowering medicines or if you're receiving insulin. The long-term complication of diabetes develop gradually. The earlier you develop diabetes and the less control to your blood sugar, the higher the risk of complications. Eventually, diabetes complications may be disabling or even life-threatening. Cardiovascular disease, diabetes dramatically increases the risk of various cardiovascular problems, including coronary artery disease with chest pain or angina, heart attack, stroke and narrowing of the arteries, or atherosclerosis. If you have diabetes, you're twice as likely to have a heart disease or stroke. You get nerve damage or neuropathy. Excess sugar can injure the walls of the tiny blood vessels that nourish your nerves, especially in the legs. This can cause tingling, numbness, burning or pain that usually begins at the tips of the toes or fingers and over a period of months or years gradually spreads upwards. Left untreated, you could lose all sense of feeling in the affected limbs. Damage to the nerves related to digestion can cause problems with nausea, vomiting, diarrhea or constipation. For men, it may lead to problems with erectile dysfunction, kidney damage. So the kidneys contain millions of tiny blood vessels. They're clusters called glomeruli that filter waste from your blood. Diabetes can damage this delicate filtering system. Severe damage can lead to kidney failure or irreversible end-stage kidney disease, requiring dialysis or a kidney transplant. For eye damage, diabetes can damage the blood vessels of the retina, diabetic retinopathy, potentially leading to blindness. And foot damage, nerve damage in the feet as poor blood flow to the feet increases the risk of various foot complications. Left untreated, cuts and blisters can become serious infections. Severe damage might require toe, foot or even leg amputation. In the skin and the mouth conditions, diabetes may leave you more susceptible to skin problems, including bacterial infections, fungal infections and itching. Gum infections also may be a concern, especially if you have a history of poor dental hygiene. Bone and joint problems. Diabetes may put you at risk of bone and joint problems such as osteoporosis. So if you have any questions on diabetes or the introduction to diabetes, you can contact me through the Life Pharmacist on the website, email me, or just call into the pharmacy in Broaddale and Douglas. Thank you for watching.